Okay, we are back again. Hopefully you're seeing this. Hopefully the sound's working and we're not dropping out on our internet. So I'm going back to feet and footwear. Where's my share screen? New share, sharing my screen. Okay, here we are again. Feet and footwear, trying again. Now, if you've already seen half of this session, that's great. I'll try and make it more interesting for you the second time around. I just wanted to tell you that we have some other topics in this program called the Stay Standing program. It's a best practice falls prevention program that we usually deliver face-to-face to groups of older adults in the community. We've been doing these online modules during the coronavirus pandemic because we think that people are still interested in these things, but maybe it's safer to stay at home.
Battery.
Oh, okay. So the core topics of the program are on the left-hand column here. We usually test people's falls risk on the first day of the program. We've already talked about balance and independent and supported aging at home. So if you scroll through our presentations on our Facebook page or on our Stay Standing program.thinkific site, you'll find those, and I can also be persuaded to put them up again if you like. We're going to do vision next week, and this week we're talking about feet and footwear. We also talk about bone health and managing medication, and they're all the standard falls prevention core best practice topics that you will find in all good multiple intervention best practice falls prevention programs. In our program, we also talk about other things such as older adult health emergencies, and that's what to do in the first few minutes after a health emergency at home while you're waiting for the ambulance. We also talk about managing urinary continence, older adult nutrition and chronic pain and sleep, because these are the things that older adults find interesting and relevant to their life. And some of these things also affect their risk of falling in a big way. I have also in our core topics column, introduction to Tai Chi. So mustn't forget Tai Chi. Tai Chi is one of the best practice programs that actually works to improve balance for older adults. Now, I just want to review what we went over in our first session on balance and proprioception, because that's relevant to feet today. So information about our body's position is sent to the brain by the eye, the inner ear, and the lower limb proprioceptors. In fact, proprioceptors in general, but there are special ones around your joints and such as your ankles, knees and hips in your lower limbs. And they include pressure sensors, joint receptors in your ligaments and your muscles, and stretch receptors.
Low battery.
I'm going to have to turn that thing off just a minute. Let me just turn this thing off. How does that go? Okay.
Power off.
Goodbye. So let's move on. So we've got someone balancing there on a hoverboard. Okay, so this presentation, we're going to consider what a podiatrist does, because the podiatrist is the health professional of choice. Yes, physios also do feet and legs and ankles and things, but a podiatrist is especially good at feet. And we're also going to consider some falls risk factors related to feet and footwear. And we're going to think about some safe footwear design features. So what sort of shoes we could wear to sort of reduce our risk of falling. Now, a podiatrist does a 4-year university degree, and they work in private settings, hospital settings, and in community practices. So some local governments even have podiatry services, which is fantastic. And what they do, podiatrists will assess and treat foot problems, and you don't need a referral. So you don't need to ask your GP to go and see a podiatrist, you just go and see them. Podiatry best practice falls prevention recommendations include foot orthoses, footwear assessment, and feet and ankle exercises. And they also are great for giving you falls prevention information. And they know a lot about feet. And imagine specializing in feet, you would have to know the names of 26 bones, 33 joints, and hundreds of ligaments, tendons, and muscles. And there, as I said in our previous live stream, there are 4 layers of muscles. There are deep and superficial layers, and they connect to the bones of the feet, within the feet, and also the bones of the legs. So yes, there's a lot of muscle names in there. Foot problems. 1 in every 3 older adults are at risk of a foot problem and also at risk of falling. So feet problems affect 1 in 3 older people and are a risk factor for falls and loss of independence. Now, sometimes we have issues as we get older with our feet, and they may include difficulty walking. We may develop arthritis. There may be foot pain. We may have reduced strength in our muscles of our feet. We may have joint deformities in our feet and toes and reduced range of motion. And we also find that when people are wearing inappropriate footwear, this can increase their risk of falling and also increase their risk of the above problems. A podiatrist will assess your circulation and your sensation. They'll ask you about any pain in your feet. They'll have a look at the deformities and the quality of your skin and the toenails. They'll look at how well your joints are moving in your feet, the strength of your foot muscles, and they'll also look at your balance, posture, and gait. So a physio will do that too, but in a more general way, but the podiatrist will zone right in on those things and they will know they're the specialists for those things. So podiatry treatment includes orthotics prescription and gait correction. And orthotics is a thing they insert into your shoe. So you can see a picture of that on the right of the screen there. There's a picture of an orthotic. They can prescribe foot and ankle exercises. They will tell you how to care for your nails. A podiatrist can also do minor surgery. So if you have some annoying thing that's been on your foot and it's not really big enough to go to hospital, it can be appropriate for your podiatrist to perform minor surgery on that condition. And this could include all sorts of things like ingrown toenails and things. So minor surgery, they also deal with pain. So if someone has a painful foot, and one of the studies that makes podiatry really relevant to falls prevention showed that when podiatrists helped people with their foot pain, particularly big toe pain, that reduced their risk of falling. So they can also look at any skin disorders and they can educate you on all sorts of things related to feet and walking. Now, here's some pictures courtesy of a podiatrist, Ben Sweeting, in West End in Brisbane. He gave me some pictures some time ago, and thank you, Ben. We're still using them. Here are some toenail conditions. Top left, we have an overgrown toenail. It looks like a ram's horn, and that person probably couldn't get down to cut their own toenails. We also have an ingrown toenail on the top right, and that's a very painful condition indeed. Bottom left, we have fungal toenails, and that person is at risk of losing their toenails due to fungus. And on the bottom right, we have an ingrown toenail that's causing some infection there, and it does look very sore, doesn't it, there? So let's think about skin and circulatory issues in our feet. When people have poor circulation, for example, they may have damage to the microvessels or the capillaries in their body, and that could be due to a disease process like diabetes. That means that the blood is not able to circulate adequately to nourish the skin, and they can have changes occur in their skin, such as in that photo there. We can see someone has very dry feet, trophic changes, and the nails have even turned yellow because they're not getting adequate nutrition. So that can also lead to poor healing. So if you were to step on something and also just a minute. If you were to step on something and you had a numb foot because of poor circulation and neural degeneration, oh my goodness, then that could cause an injury and it may not heal very well, and that leads to ulceration. So poor circulation damage to the microcapillaries, damages the nerves, and it undernourishes the skin and leads to all these problems. So typical disease would be diabetes, where you find this happening. So diabetes has a whole lot of other problems associated with it, but one of them is poor circulation and numbness of the feet and poor healing. So that can actually, some poor people actually lose a limb because they might have an ulcer that just gets worse. Okay, so let's move on here. Joint disorders. These can include arthritic changes in the joints. And we've got some pictures here that are really interesting. On the top left, we see someone with some pretty bad arthritic changes. Very common though. I've seen many people with feet like this. So what happens, the joint, the bone is eaten away on one side of the joint and then it grows abnormally on the other side of the joint. That can be a rheumatic change. And there's other deformities such as claw toe or hammer toe. And I think this is where our sound cut off last time. I really hope that you're hearing me at the moment. So claw toe is where the tendons and the soft tissues get really tight underneath and the toe just starts curling in underneath. Hammer toe is similar, but it's pointing out at a right angle, so like a hammer. So you can imagine how uncomfortable that would be to walk on. Bunions. Bunions, so you can see this person also has a bunion, and it's where the ball of the foot, the bone starts growing abnormally. And why that happens, that can be due to a few things, but the angle of the big toe starts to move across. So and the joint starts to grow abnormally. So there are different degrees of bunion like severity, I suppose, and there's mild, moderate, and severe. And I would put this one getting towards the severe, definitely. So there are exercises you can do. We've been doing some exercises this week in our live streaming sessions. You might have seen some of them, and I'll put some more of those up next week. But you can, if you see your podiatrist, they're able to prescribe some really good exercises that can delay or even prevent the development of bunions. And there are also sort of orthotic devices and things you can wear to separate your toes and so on. I'm not sure about the research behind those ones, but definitely the exercises are worth trying. Now, they can impair your foot strength and stability. So if you have joint deformities in your toes, that can cause pain. So it's hard to walk on and you might alter your gait because of pain, but also because of the joints and affecting the way you move, and also your muscles, the lever arms and so on your muscles. So it can affect your strength and your range. So all these things can impair your foot strength and stability and increase your risk of falling. So better to get onto these things when they're at the beginning stage. Go and see a podiatrist. As soon as you notice something going on, go and see your podiatrist and get them fixed. Okay, now feet can tell us a lot of things about other medical conditions going on in our body. And we've talked about diabetes already with poor circulation. So different vascular conditions can show up in the skin of your feet because there's an extremity, isn't it? So if you have poor circulation, your toes are probably going to be some of the first things that start to show these symptoms. Inflammatory conditions like arthritis, so we have rheumatoid arthritis and osteoarthritis. Both of these lead to joint deformity and can lead to pain. Neurological or muscular conditions such as stroke. So you might have loss of sensation in the sole of your feet. That can occur in stroke and diabetes. With a stroke, a lot of people have weakness. So one side of their body can be affected with a stroke, and it may mean that they can't lift their foot up. So normally when we walk, we move our foot from heel through to toe when we're walking. So if this is, imagine this is actually a foot. So we go heel through to toe for each step that we take. But if you can't do that, if you can't put your foot down, if you've got a foot drop after a stroke, then it looks like this. You put the front of your foot down all the time and you can end up tripping on your own foot. So not good. And there's exercises that we can do, but sometimes people who've had a stroke, they may not have a very good outcome even with exercise. So they end up wearing an orthotic. So it's often looks like a device that keeps the foot angled at about 90 degrees. And they may need a stick as well. Often that's the outcome. So let's think about feet and footwear. The brain relies on correct information from foot receptors to help coordinate balance. And our footwear actually influences the messages sent to the brain. Your footwear can be the only thing between you and the earth that tells the brain how you are going walking on the ground. So if you're wearing painful or ill-fitting shoes, or shoes that have too thick soles, or if you have a foot problem, this can impair the messages from the feet to the brain and increase your risk of falling. Now let's look at some safe footwear features. You can see this slide says a low heel height, less than 2.5 centimeters is recommended, and a squared beveled heel. So that just means that the body's weight is supported evenly around the whole of the heel, not just on one little point like a stiletto shoe. Having a supportive collar around the heel and the ankle is recommended as well, so that you're not slipping around in your shoe. We all love our old slippers, don't we, in winter? And I've seen so many people who get around the house in these beautiful old Ugg boots and their feet are moving around, and it's really dangerous. So beautiful and warm, but very dangerous to walk around in. Okay, some more safe footwear features include a slip-resistant outer sole. So the beveled sole under the shoe helps you not slip around. Having a thin but firm midsole. So sometimes, you know, there used to be these shoes, I won't tell you the name of them, but they're kind of an Australian icon, that you just put them in your handbag and they fold up like this. They're not recommended because they don't offer you any support at all. I mean, it's okay if you don't want to get feet dirty, but that's probably the only use for them. Adequate room for your toes. So you need to be able to move your toes around. And if you have shoes that are pressing in on your toes, you know, remember those old pointy shoes, pointy-toed shoes? They are the cause of many bunions now. So we need adequate room to move our toes around. And also recommended is breathable material. So avoid synthetic uppers. Have some nice breathable fiber like leather, cotton, or well-ventilated uppers for your shoes, so you don't grow fungus and get fungal nail infection and bacteria in your shoes and things. Okay, so here's a self-assessment checklist for your shoes, and this content has been adapted from Hilton Menz's study from 2008 called Foot Problems in Older People Assessment and Management. So some of the questions we can ask, if you have a quick look at your shoe that you're wearing right now, is the heel of your shoe less than 2.5 centimeters thick? Does your shoe have laces, buckles or Velcro to hold it onto your foot? Do you have 1 centimeter between your longest toe and the end of your shoe when standing? Do your shoes have a well-padded sole? Are your shoes made from a material that breathes? Do your shoes protect your feet from injury? And are your shoes the same shape as your foot? Now, if you could answer yes to all of those things, then you're probably wearing a good shoe. So here's another way of saying that. We have some safe footwear solutions and a column that says no and a column that says yes. So the yes column says firmly fitting shoes with support at ankles and instep. Yes, that's what we want. A broad heel for even weight distribution. Heels less than 2.5 centimeters high. So you don't have to have them completely flat. Slip resistant sole, a thin but firm midsole, which allows sensory information. So we want the shoes on the midsole, we want the shoes to bend where our foot naturally bends. We don't want to be wearing, you know, ski boot type shoes. We want some shoes that will adapt to when we want to move our foot, but not too thin so that we can feel everything. We don't want to feel everything. We just The brain just needs to know the surface we're walking on and so forth, but not too thin because then there's no support. Okay, thin but firm midsole allowing sensory information. Seamless shoes for people with circulatory problems or circulation problems. So this gets back to the people with blood vessel damage, blood vessel disease. If you have a seam or a ridge on your shoe, then it can cut into your foot and you may not feel it. So you may not realize when you're developing a blister, which could turn into an ulcer, which may not heal, and that can turn to gangrene and blood poisoning and all sorts of things and amputation. So that's where that pathway goes. So seamless shoes for people with circulation problems are a good idea. And thankfully, there's more and more of those appearing in the shops now, and they're quite nice, some of them. An upper of breathable material. So like we said, we don't want to be growing fungus and bacteria in our shoes and in our toes. This slide says shoe and foot tracings. So some podiatrists do this and some podiatrists don't. They may trace your foot to get the outline of your actual foot, and then they may trace your shoe on top of it and just see where the differences are. So it's more of a demonstration for you to see if your shoe is appropriate or not. And the slide here, the picture here shows this person has a bunion, but their shoe, the boundary of their shoe is within that area. So that bunion's going to be pressing on the side of their shoe and probably getting worse and worse because of the pressure from the shoe. So in general, there should be a thumb's width distance between the end of the shoe and the longest toe. Some people say 1 centimetre. So that's all I wanted to talk to you about today. Hopefully this is streaming well with sound. Thank you for the feedback we had. Really enjoying your company. If you want to leave a comment, please do. I will definitely respond. And we are going to be back, or I will be back on Friday next week with a similar presentation, this time on vision, about what really works to reduce your risk of falling. 9:30 Australian Eastern Standard Time, Friday next week. That's June the 1st. Okay, and before that, we will have Monday and Wednesday exercise sessions, home exercises for independence. You can join us at 9:30 again, Australian Eastern Standard Time, right here. Bye now.